Hello, everybody. First of all, thank you so much for having us here today. Thanks to SAMCEDA for obviously giving us the award, and thanks to Roseanne for the extraordinary kind words. To give you a little touch about who we are, we looked at the world about 5-6 years ago, seeing that there's a fundamental change that's coming about. Really what I sort of call the datafication of health. Electronic health records are coming about, sensors and wearables are coming about. We have claims, you have genetics, you have social media. And the question I asked ourselves was, it's great that we're generating all this wonderful data, but how is it helping us live better lives? How is it helping us deliver better health? And so the question we asked ourselves is, why can't healthcare as a system fundamentally become anticipatory? Why can't it be hyper-personalized to me? And why can't it always be high-valued? And that's sort of what we think about in terms of what we call predictive first healthcare. How do we enable healthcare to be predictive first? And we had this crazy notion that maybe medical science was somewhat relevant when we looked at analytics. And the question was, how do we bring these two worlds together? How do we transform and advance the world's medical knowledge and health data so we can deliver these real-time practical insights so each of us, every day, can go ahead and receive the best care possible to live the best life possible, so that we can diagnose and manage, prevent, and predict 100x faster at 1/10 the cost. Not only here in the US, but really worldwide. How do we change the world? If Google changed the way we search, Facebook changed the way we connect, how can we change the way we care? And when we really think about it, we need to be able to scale medicine. It's about the way we arrive at that place is, it's great if a doctor has 2 hours of time to spend looking at your data. The problem is they don't. They have 8 minutes or less. So how is it we can help optimize? How can we help force multiply? How can we help empower these physicians? Because they really are very brilliant, but how can we combine that analytic power and scale of big data with that brilliance of the physician so that we can go ahead and power medicine at scale? Not only for health plans or health systems, but also for each of us as an individual. How can it help me make a better choice every day? And the reason now is different than from before is we've heard about how many times that smartphones really last 7 years. We've heard a huge amount of computing power changes in the last 10 years. And fundamentally because the character of data itself has changed. The amount of data that we generate on Facebook today is literally equal to like 10 times what we did 20 years ago, right? So the fundamental question is, with that resolution, with that scale, with that tempo, what can we do about it? And what it's doing is enabling us this shift from a reactive care where we're always behind the puck, to how do we get ahead of the puck in a way that's truly personalized, going from a population risk perspective to a way that's very personalized on a per disease perspective, from reactive to proactive, and looking at being able to take the best of data science and combine that with our data to really help deliver that best care, so that we can enable real-time data science to be part of every healthcare interaction in a way that's dynamic, personalized, and predictive. And so in some senses, we are a medically driven analytics platform that enables us to make sense of very large amounts of data or very small bits of data in a way that is actually practical. How can I use it? Should I go to the ER? Should I go to the urgent care? Should I get this lab test? Should I ask this question? These are very simple questions. Should I have the banana or should I have the coffee? It depends on the day and the time. One is better than the other, right? And so how do I help make these different changes? And we sort of package these insights into what we call health data stories, because that's the ways we as human beings communicate complex insights, is through stories. And fundamentally what we're trying to answer is what to do for whom, when, and why. How fast do I need to engage with this diabetic? Is it a slow, steady state increase of risk, or is it a dramatically increased amount of risk? How do and when do I do that? And how do I combine these two worlds? And to give you a touch about how we do things, if you guys remember the days of Altavista and Lycoses of the world, they would really look at the world as one document, two document, the 10 millionth document. But what did Google do that enabled that quantum leap of difference? It looked how everything connects. So it's not just about the data, but it's about how the data is connected. And that's really what we've done. And so many of we see data that looks like this in rows and rows and rows. And it's literally impossible to make sense. I mean, I get 1,000 data points about an individual. How am I in 8 minutes or less, more 2 minutes, to make sense of this? But what if we can look at this longitudinally and actually know why and how things are actually connected, right? And so frankly, when I do that, how do we project forward from that? And so we can come back into something that's very real time and meaningful. So I can sit there and say, what diagnosis is being missed if I actually look at the entire spread of this individual, and therefore be able to get that person on the right course of management? For example, someone like Mary here, who's 86, who has mitral rigor, left ventricular hypertrophy, and the labs are going in a particular direction, how can I identify as soon as possible that she's having the first stages of congestive heart failure so I get her on the right management? Because I don't want her to spend the next 3 months and have that acute event and end up in the ER, right? And how can we do so not at one, but at hundreds of thousands of people? And that's what we've done. We've done that actually over millions of people now. And actually, it's been great to see that feedback and ability to help improve people's lives. And it's by combining not only the clinical, but actually the behavioral and social. It's about understanding how I act, from a medication adherence perspective, how I interact with people, what is my social support structure, and how can I leverage all of that to predict and measure health so I can understand what the health is going to be, the risk, and the cost, and so that we can provide the best possible care as soon as possible to deliver that. And that really helps us start understanding how is it we can jump in to understand what to do for whom, when, and why. Because I want to be before that acute event, before things progress past a certain point. Because when I do that, the benefit to each person is maximized, and the overall cost to us is actually minimized. And that's really what's allowing us to do that. You know, we've had now dealing about over 7 million plus patients in terms of data, 30 million patient years. 34,000 physician hours have gone in to make sure that we're actually learning the right things, so we're actually delivering real clinically meaningful things. We've actually, you know, affected approximately about $1 billion of business, found about 300,000 actual diagnoses for people that actually matter. You know, and if you really think about us as an organization, we're half physicians, half data scientists, and people who understand care delivery, with extraordinary people such as Costa Ventures, such as Sandbox Industries and the best of the Blues and Independence, and great partners such as Google, who is helping us change the way we actually search for health on the web. So if you think about us as a team, here's a few of them. Not everyone is in the office that day, but you know, a good-looking crowd, so-and-so. But really, half data scientists, half clinicians, bringing these two worlds together to go ahead and help us all live better lives. And so, as I said in the beginning, thank you so much for having us here today. We're honored by the award. Looking forward to how we can work with all of you. We're already working with some of the people over at Alien Vault and others as well. And frankly, that's what we do. Lumiata, powering predictive healthcare at scale. Thank you very much.